At this meeting, we presented one more study using this databases of the so-called real world, which has become one of my favorite topics. So we use data from a source called Komodo, and Komodo allowed us to look at over 1,000 patients with triple-class exposed myeloma. And really what we're asking is what happens when those patients present themselves for additional treatment, and how long would those treatments last? The reason behind the question, of course, is now with the advent of bispecific antibodies and CAR-Ts, you want to know what is the benchmark? What are we talking about for that group of patients who has, unfortunately, exhausted the standard therapeutics? And what we found is that still the duration of clinical benefit is pretty small. For many of these patients, the treatment will last certainly less than a year, often less than 6 months. Which really presents itself as an opportunity for additional development, and as I mentioned, particularly with the bispecifics and CAR-Ts. And this is especially important because those two types of therapies may not necessarily depend on intracellular signaling like traditional small molecules do, because after all, they're just harnessing the immune system. So we want to see studies like this repeated in another 5 years. Once we have the follow-up and the number of patients, where I could come back and report to you and say, yes, triple class exposed, it doesn't matter because we're still talking about another 5 years because of the advent of those therapies.